Seattle was one of the early epicenters of the coronavirus, but obviously some bold moves that the city took early on prevented seeing some of the more dismal numbers that we've seen elsewhere. Give us a status update. Where is your city in terms of cases, in terms of deaths, and in terms of the testing capacity?
So on the good news front first is, when we at the height of the outbreak here, we had a transmission rate of about 3, which means for every person that got sick, they gave it to 3 more people. So we were seeing cases rise really quickly. We were able to do our measures pretty quickly, first by having the tech companies Telecommute as well as the city and other large employers, and then do the stay-at-home order. As a result, today the transmission level is below 1. So every person that gets the virus is not even transmitting it to another person, which is really great. I think all of the epidemiologists are saying that's where you need to be for a significant period of time. The bad news is we still do see new infections and new people dying. And I think probably the worst news is we are nowhere near the testing capacity that we need in this city to really open up our economy in a meaningful way. So we've been working with the governor, talking to the federal authorities. We need more testing capacity on a significant level, and we're also going to need more contact tracing. What Mayor Bloomberg is doing in New York literally needs to happen in almost every major urban area and state if we want to get this right and really restart our economy.
Now, what is the testing capacity that you would like to see? If the White House is saying they'll release enough tests to test 2% of the residents in the state of Washington, is that enough? And do you believe they can actually get to that number?
So first, I'd like to see the plan for getting those testing capacity. It would be really helpful. We were for a period of weeks almost down to 0 in the city of Seattle on our ability to do tests. They were able to do it in hospital settings, and our first responders had test kits. But like the rest of the nation, for example, we are struggling in Washington state with our adult senior homes and the number of outbreaks. And we were pushing really hard in the city to get more people tested and then quarantined. And we did not have the capacity to do that. So I want to see that plan. I've retained a group of medical advisors, international and local, who are really helping us march through the benchmarks we need to reach if we want to reopen safely. We've got to reel the film back and remember the reason we're here is because we missed it. We missed the rise of the virus. And as a result, the only tool we had to stop it was to shut things down. We can't afford to do that again in America. So when we reopen, we have to have the testing capacity and the tracing capacity, or we could end up not just back where we were, but in a much worse place.